Good morning, ladies and gentlemen. Today is the 6th day of the biggest implantology event of 2020. It's a beautiful day, as I always say. And once again, we are starting the 6th day with a bang because of the personality we have, you and we have in front of us. Ladies and gentlemen, today is the 6th day and the last 5 days have been such a wonderful, overwhelming, pleasurable experience. It has only been possible because of the kind of enthusiasm and zeal that you guys showed. Ladies and gentlemen, as we are marching today on the 6th day to the biggest implantology event, I hope your support remains the same and I hope you will be always there with us no matter what. Ladies and gentlemen, starting the 6th day with a very special speaker, a person who's very close to me and who's very close to team DentistChannel.Online. Ladies and gentlemen, Dr. Arpit is not only a speaker, he's way more than that. He's a friend, he's a mentor, he's a guide. Overall, he's a well-wisher. Ladies and gentlemen, there are very few well-wishers in this world. Dr. Arpit rightly says, the good people in life, they only come once. And he is one of them who's blessed us. In fact, we are blessed to have him as our dear speaker for the 6th day. And I can't be more excited than this to proudly tell you for the kind of help, support and encouragement he's given us to make this show a grand success. Before I move to his introduction, ladies and gentlemen, on behalf of y'all and on behalf of Team DentistChannel.Online, I would like to thank you, Dr. Arpit. It's because of personalities like you and all our well-wishers and our esteemed speakers that the show is going on. It's always said that the show must go on. But for the show to go on, you need these strong pillars who would be there behind you no matter what. And I'm proudly telling you that Dr. Arpit is one of them who promised me that Ruben, the show will go on no matter what. Ladies and gentlemen, presenting to you Dr. Arpit Sikri. A short introduction about a speaker. Dr. Arpit is currently working as a senior lecturer in the Department of Prosthodontics, Santosh Dental College, Santosh deemed to be University, Delhi. He had earlier worked as a senior resident in the most prestigious dental institute of the country, that is the Maulana Azad Institute of Dental Sciences, New Delhi, India. He is the youngest dental surgeon of India to have completed his postgraduate diploma in hospital management from the National Institute of Health and Family Welfare, New Delhi, India, and that too with a distinction. He has also been conferred with a diplomate fellowship in the field of implantology by the World Congress of Oral Implantology based in Tokyo, Japan. Throughout his academic career, he had been awarded with gold medals, being the topper of the university back to back. He has authored a book on oral pathology under the Scientific MedTech Publishers. He has to his credit around 28 books under the Lambert Academic Publishing and more than 100 national as well as international publications in various reputed journals. He is the editor of the WebMed Central, associate editor of the Current Dental Research Journal, and the assistant editor of the Asia Pacific Dental Journal and the Eye Dentistry Journal. Ladies and gentlemen, presenting to you Dr. Arpit Sikri, live on the 6th day of the biggest implantology event of 2020. Over to you, Dr. Arpit.
Very good morning, everyone, my very dear friends in profession. At the outset, I would like to thank Mr. Ruben, who is a brother more than a friend, very sweet brother. And, we have been, as he said, we have been working like pillars and we'll continue to do that. And definitely, Mr. Siddiqui, the whole team of Dentist Channel Online for coming up with one of its own kinds of virtual world level dental implant expo. So my salutations to them and thank you so much for giving me a chance to come up to this wonderful podium. And I would like to say that I'll be taking around 45 minutes to complete my presentation. As Mr. Ruben, introduced me, I'm Dr. Arpit from the Department of Prosthodontics in Santosh University, Ghaziabad. And I feel namaste to all my friends in profession, India or pan-India. Well, ladies and gentlemen, it's a very auspicious day. It's happy Ganesh Chaturthi. So I feel may Lord Ganesha bless you and definitely remove obstacles in your life on this auspicious day. And how would I forget the goddess of knowledge? Without this, I feel my presentation is incomplete. So taking blessings of Ma Saraswati, let's move on with the presentation. So friends, I'm going to speak on the topic implantology, the current paradigms. I feel I should change the topic to implantology 2.0 because whatever, we are reading, we are really updated. We are updated with the new knowledge of implantology, what is going on. And let's see in the subsequent slides. So dental implants, just to introduce, is the emerging discipline commonly known as the third dentition, which has really improved the overall health, overall oral health quality of life, and definitely is the first choice of treatment much over the removable and the fixed prosthesis. As you can see very well in this video, this young, sweet lady is enjoying her birthday. And definitely, I feel she could have enjoyed her birthday, well, if it was rehabilitated with dental implants, just on a lighter note. And definitely, dental implants do good because we have so much of concerns with the fixed dental prosthesis. So there can be caries of the abutment, there can be periodontal issues, but more so, we are doing very well as far as we are talking about the dental implants. Well, friends, I was seeing there has been plethora of articles which are there in the index in the reputed journals, and I was going through so many articles in index journals. The evidence is huge, and with this evidence we have faced so much of controversial issues among the researchers. There has been active uptake of the research which is going on. Well, moving on to the evolution, we can't forget salutations to the father of implantology, implant dentistry, Dr. Ingvar Brenmark, the Swedish orthopedic surgeon. Hats off to you, he's no more with us. But yes, whatever implantology we are reading, I feel we should have dedication to this great man. He has done so much of research pertaining to the delayed loading protocols, pertaining to the osseointegration. And with a period of time, my friends, there has been a new concept known as the muco-integration. So osseointegration, we are all the more related to the bone, but muco-integration, apart from the bone, we are all, we are all associated with the soft tissue seal around the implant. So I was reading some recent classification system, and as there has been so many implant sizes based on the length, based on the diameter. Now we have availability of each and every implant system, implant diameter, implant length. So you can't say no to the patient. Now you have everything. So this was one of the latest classifications which was based on the length, the diameter of the implant. Moving on to the dental implant components. So we read about, and very recently we have the implant drills which are more so diamond coated, so as to reduce the heat generation, so as to reduce the thermal necrosis when you are doing osteotomy or doing implant bed preparation. And yes, more so, we were coming up with the sonic or the ultrasonic drills and the piezo surgical drills. So I was very happy to know that they are creating much less thermal necrosis as compared to the conventional drills we are using. In fact, the wear of the conventional drills is much more over the period of time. So studies definitely suggest that we can go or we can think of the ultrasonic, sonic or the piezo surgical drills. And there has been a new design which has been created, which says that generally we are using the surgical drills which have a component for external irrigation. but this particular implant surgical drill has component for internal irrigation. So obviously the temperature or the thermal necrosis, the temperature, optimum temperature created inside the osteotomy side would be much less what you are using in the conventional way. And I was seeing, there have been so many manufacturers coming up with the thread design. Some say, okay, we have a square type, V type, buttress type. I feel there has been so many thread designs in the market, but over the period of time, I am feeling that yes, the thread designs are much coming up with the aggressive threads, or they are more self-cutting, which are really relying totally on the primary stability of the dental implant. And there is a new rule or the guideline, the 5-thread guideline, which says that to ensure the primary stability, you need to have at least 5 threads inside the bone. When you're talking, you need to have at least this much threads into the bone. This was one of the study. I was really mesmerized to read this study. And over the period of time, the load distribution to the bone will definitely reduce, as you can see and appreciate in the figure. And particularly, guys, we see the immediate implant placement in the extraction sockets. So definitely we have to see the interseptal bone. We have to, we don't have much bone. We have to rely on the grafts. So there is a new design, the mid-crestal and the apical vein thread design during the immediate implant placement. As you can see very well in the middle, you have a very aggressive kind of thread design, and into the apical also, so to engage more and more of the residual bone which is available after the tooth extraction. One more design, particularly when we are immediately placing the implant, that comes up as a reverse tapered body shift implant, that is much opposing the design which we are using in the conventional implantology. And friends, craniofacial or the extraoral implants. Now, sometimes we have to, we are going with the extraoral reconstruction. We have to give a cranial plate to the patient. So generally we take help of the implants, but due to limited bone availability at this region for fabrication of the cranioplast, we need to have a recent design, that is the buttress thread design, so as to engage the limited craniofacial bone which is available to us. And there have been issues when you are using a ball abutment. So any overdenture attachment, we generally prefer locator attachments. We have ball attachments. There are so many attachments, but this attachment recently, friends, has been found to be really locator RTX attachment system has been really good, because the maintenance issues are less and it is quite durable and you can use over the period of time. It doesn't get wear and teared away as what you can see with the conventional ball abutments. And one more thing, now in anteriors we have issues with the angulation of the abutment. So angulated screw channel abutment has provision for 360-degree. So we can very smoothly and very easily localize the channel, and we can either detorque or either we can torque the implant or the abutment much into, so that to provide stability to the prosthesis. Well, moving on to the implant biomaterials, I feel all of us know titanium has been a gold standard in the field of implant dentistry. But I feel that titanium is a double-edged sword, because over the period of time, there are evidence-based studies which say that over the period of time, titanium releases corrosion byproducts. Although pure titanium is really good, has been doing really good, it's not to go against any material, but it is what the scientific data or the evidence says. So this is how there has been over the period of time release of the metallic nanoparticles, a recent term given being the metallosis. So into this, there has been so much of release, the corrosion byproducts, because of the layer of titanium dioxide. So that, over the period of time, that gets released and released and released. So this can cause even, the hypersensitivity issues, generally type 4. Now, there have been so many issues into, the evidence-based studies, what we see And definitely we talk about the titanium versus zirconia. So if we see the plaque adhesion, the biofilm adhesion has been more in titanium as per the SEM studies. So it is less over the zirconia implant. So this is how again we came up with the advent of zirconia implants and abutments, keeping in view the improved flexure strength. We also came with the anatomic analog or the prototype of the anatomic zirconia implants. But there were issues over the period of time because ceramic was really brittle in nature and it had very low tensile strength, and there were incidences of implant fractures. So this gave birth to a wonderful innovation known as peak implants, that is the polyether ether ketone, the polymeric implants, which really came up over the controversies between titanium and zirconia implants. So there were two kinds of peak implants, the unmodified and the modified peak implant. The modified peak implant definitely did so well because of the incorporation of carbon into the peak implants. So this CFR peak was, more popularized as an orthopedic or spinal implant. We use, as you can see in the figures also, there has been huge implants which have been created with the help of carbon fiber reinforced implants. So we also have, as I told you, the craniofacial implants for the reconstruction of the cranial plate. So this is how, with the limited availability of the bone which we have in this region, we are taking active, integration from the peak craniofacial implants, since they are, doing beautifully well in case of the mechanical properties. Mechanically, they are the best, I feel. And then we had to make the biologically active peak implants. So we had coated peak implants, we made it more bioactive or bio inspired peak implants. And there was a variant of peak which was polyether ketone. Now this was used particularly in cases that require reconstruction of either maxilla or mandible. There were huge or the larger frames of peak which have been used to construct, in a way we say, jaw in a day technique. So this is how we can reconstruct the whole jaw in a single day. That is the beauty of PEC implants. And there was another classification, V43. These are the magnesia based implants. The silicon nitride came up into picture. It was quite popularized, but then it was found that it is more antibacterial. So this was how the silicon nitride came up as a coating over the titanium. So we use this implant system also, very limited research, particularly on this topic. And very important, friends, this is the need of the hour, the 3D printed implants. I feel today when we are talking about so much, how can we forget about the 3D printed, about the additive manufactured implants, which are namely, with the help of selective laser melting, you can see the powdered infusion or the powdered bed infusion, layered by layered fabrication of the titanium implants. And there was a study, friends, that selective laser melted titanium implants have been into picture, particularly in type 2 diabetic mellitus patients. And limited research is there. So let's see how we'll be coming up with this as a success in diabetes mellitus patients. The custom 3D printed subperiosteal implants, particularly they can be used when you are going with the, when you have atrophic mandibular cases. So you have long framework 3D printed implants. This is one of the 3D printed implants, with the abutments, everything that is again selective laser melted. And I would say these can be beautifully known as the patient specific implants. And yes, definitely I have seen into the evidence base that it is used to construct the whole temporomandibular joint. So see how the innovation is doing really well with the patient specific or the customized implant systems. And again, the 3D printing is doing really well, as we are talking about the root replicate implant. So you can have a scan, you can have a CBCT, you can have STL, which I'll be showing you. So based on that, you can create implant. If you are quite skillful, if you have, you know, knowledge of these sensors, softwares, you can make implants customized as, you know, in the patient's bone. So they are quite specific. Now coming up to the implant surface, so there have been so many implant surface treatments, and graphene nano coating and spikes are doing really well. Now if we move on to the microstructure level, as you can see, any bacteria, notorious bacteria coming up to the surface of implant would really die, and that's quite bactericidal. So this is how, you know, the research is going on the graphene nano oxide being anti-corrosive also. We also talk about the zinc oxide nanoparticles. We are into the era of nanoparticles. See, we were talking about the macro surface, the micro surface, and now we are talking about the nanoparticles or the nano surface treatments. So there are so many nano surface treatments, but you know, due to limited point of time, I have explained just the important ones here. We have the gold nanoparticles again, which would help you know, to promote the osseointegration. And another thing, the UV rays. So UV photofunctionalization, this is how the ultraviolet rays, they help to improve the hydrophilicity of the implant surface. You can very well compare the conventional surface, and now you can see the photofunctionalized surface, improved hydrophilicity of the implant. But caution is, don't use too much of UVC, because it will lead to, as a double-edged sword, it will lead to so many problems. Another, hydrophilic titanium implant surface, as you can see. So this is how the osteoblast titanium implants. The laser textured, so we use erbium YAG laser, we use ND YAG laser. So this is how they help in the laser decontamination of the surface. So any bacteria, any notorious microbe present over the surface, so as to reduce the incidences of peri-implantitis. And another terminology came up to my mind, that is the pharmaceutical dental implants. So generally the localized drug delivery system, we use doxycycline, we use simvastatin, alendronate. There are so many drugs which have been used in other aspects, but for implants, they are doing really well, particularly having the antimicrobial effect. So bioactive glass technology again is doing really well as far as the bone regeneration and implant dentistry is concerned. So bioactive films or coatings are created over the surface of implant, and this is how they have the potential to reduce the microbial film or the biofilm. So the best point I was seeing, why to go for the surface treatments when you have a beautiful technology, that is the additive manufactured or 3D printed implants. You can make, or you can, you know, guide the software, whatever surface treatment, whatever kind of roughness, whatever kind of porosity you want over the surface of implant. And nowadays the you know, the sensors are well equipped, so whatever instructions you will be giving, you will be, you know, taking that particular implant with, or with the kind of surface you want. So this is how I feel, once this beautiful technology comes up over the period of time, I think there would be no requirement for any surface treatment. And this was, you know, we are talking about so much about the implant surface decontamination just to reduce the incidences of peri-implantitis. And there was a tool, my friends, I was seeing, the implant disease risk assessment tool, which you can use in your patients just to assess the kind of infection, just to assess the kind of peri-implant disorder a patient may face in future. So coming up to the diagnosis and treatment plan, I feel it's very important once you are diagnosing anything. I think the treatment plan comes up. I feel 50-60% of your work is already done. And in your clinical practice, my friends, never leave your implant patient unattended. Don't treat a stranger. As you can see, such things may happen when you are into your implant practice. So such beautiful things you are gonna see, just on a lighter note. And we are talking about so much about the conventional radiography, so many intraoral radiographs, and over the period of time, CBCT, cone beam computed tomography, and MRIs, they are coming up as the gold standard, with CBCT doing really well with the 3D diagnostic data. and there has been a proper diagnostic workflow for the implant. Whenever you are planning the implant, how to go about, we always do a virtual planning before, much before. And I think your 80 to 90% of the work is already done before the placement of the implant. And friends, very important, always go guided. So there have been chunk of articles which suggest that always go with a surgical guide fabrication or the surgical template. Whenever you are using a surgical template, and nowadays that too 3D printed surgical templates, they give you an idea where to go with the precision, with the angulation, with the orientation. And this is how you can place your implant without causing any trauma to the underlying tissues or the important anatomical areas. And as I told you about the 3D templates, this is one of the workflows. What we do is we take a CBCT scan. So we have one file of CBCT and we match it with the intraoral sensor. So we have an STL file. We superimpose. This is a dual scan protocol when we merge both the files and we check where to place the implant. So if you are well versed with the computers, with the desktop scanners, I think we can do really well with the surgical templates, with the diagnostic virtual workflow. And not only this is for the conventional implant. There have been 3D printed guides for placement of the zygoma implants. One needs to be really skillful when we are placing the zygomatic implants. So that's very important. One is really difficult, I feel, to place the zygomas. So there is a connotation, my friends, that there is no bone, so there should be no implants. Not at all. There are so many strategies, there are so many alternatives which have come up. So the bone regeneration strategies with the repair, with tissue engineering, so many grafts we have. We talk about the PRFs, and there have been lot many strategies which have been come up wonderfully. And we are talking now about the mesenchymal stem cells or the regenerative strategies, how they can be used and they can help and they can come up as a boon into our implant practice. So I was reading about PRFs and PRPs, again doing well. The using the tenting screws. So whenever we want to place a graft, particularly we prefer autogenous bone graft, and this is how the tenting screws are very small and they help in the apposition of the graft or with the PRF into the desired area. And we all know about basal, the backbone, as Mr. Ruben told us, the strong pillars. So I feel basal bone is a strong pillar. It's a foundation. So this is how the basal bone is resistant to resorption, and over the period of time, there have been innovations. Since this is beyond the scope of the presentation, because I'll be taking too much time in this, so I'm not going so much into detail. So we have the basal, we have the zygomas, in which we need to be really skillful. We need to know about the anatomy of the malar bone, and this is how we go guided with the pterygomaxillary implants or the pterygoid or the tuberosity implants. So this is how we have to avoid the sinuses, because we can't totally rely on the surgical approaches. The surgical approaches, there is always, I feel, with due respect, there is always some unpredictabilities associated. It can be with the implant, but it's more so in the surgical approach, just to avoid the bone grafts or the the regenerative thing, and coming up with the combination of regeneration and such kind of unconventional implant systems would be a good idea. And there is a new technique that is one of my friends, that is the tall tilted pinhole immediately loaded technique. Again, that connotes very well to the immediately loaded longer implants. And my friends, it's not about the long implant, the short implants, the mini implants, they're also doing really well. The survival rate is very high. It's around 97.4%. And this is how they have been actively used as overdenture attachment system. The orthodontists are using it really well. The ultra short implants are also coming up, particularly in cases who have medically compromised situations and in which you feel they would be a failure. So they are very easy to be retrieved, and they are also doing well. The narrow diameter implants, most likely, sometimes and many of the times, we have a very narrow mesiodistal width or space, and orthodontic closure is not acceptable, or it is the adult orthodontics which is not success to this. So you can use a 2.9 to 3.3 mm very narrow implant, and you can very well rehabilitate the implant later on. So this is how the technology, this is how the use of narrow diameter implants can be used, particularly for the congenitally missing lateral incisor and even for the overdenture fabrication. We also talk about the welding, or another term for this is sin crystallization. So weld one concept is a very good thing, particularly if you are going with the implants in 72 hours. So you try to weld with a thick titanium bar, and this is how you keep the implants much into place to avoid any micro motion. Generally, we do it particularly when we are talking about the immediately loaded, the basal implants. The hybrid abutment system, again, we use a combination of the abutments, particularly to maintain the aesthetics when we are talking about the anterior aesthetic zone, or we are talking about the emergence profile. And I was seeing erbium lasers doing really well. Now that is, very difficult to remove the implant crown from the implant. So we keep using the conventional strategies, but erbium laser has come up with the innovation with which we can very well remove the implant crown without causing any discomfort to the patient. So on a lighter note, one of my students sent me this, I think the branch of prosthodontics is very well, you must be knowing the teeth arrangement has been a hassle. And I too found it difficult when I was a BDS second year student. So one of my students said, okay, Google it out. Okay, how to do teeth arrangement very easily. And 230, how to kidnap the prostophiculty. So thank God I am safe till now. So just on a lighter note. So coming up with the procedures, strategies, or the concept. So very important strategy is the shape memory alloy abutment system. There have been controversies between the cement retained and the screw retained abutment system. So this is how, if we talk about, these are the Smilock sleeves. This is also known by the name of micro lock implant prosthetic system, or the Rhodos bridge because of the manufacturer's name. So this is how we can place. There is a shape memory system. When we tuck in the prosthesis, there is a proper friction lock or the friction fit of the prosthesis. So no problems. They are just overcoming the problems which were actually associated with the screw or the cement retained restorations. Another beautiful technology, as we all know, osteodensification, when we are trying to compact the bone more and more, and particularly it may be in knife edge rich cases with the help of densa burrs. So we do a counterclockwise, drilling, which is not as per the conventional drilling, and it has done really well by increasing the primary stability of the dental implant. The socket shield approach, as we all know, we are trying to preserve the bundle bone, and this is how we try to remove the tooth or the root by after decoronating as atraumatically as possible. So we can place the implant, and the results, the aesthetics, the emergence is really beautiful. The technology is really upcoming and is really good. We have been almost talking about the platform switched and platform matched implant. So we use a narrow diameter abutment system wherein we have a reduced incidences of the microbiota at the crestal level. So this is how the platform switching is doing really well. And we have been talking about the concepts like all on 4, all on 6, all on 8 also. And very new articles suggest that go and come up with a tripodal configuration and all on 3 concept, which is really good. I was also searching on a single implant retained overdenture, although there have been so many systematic reviews, but let's see how it comes up as a success. The conometric concept. So there are conical abutments which are present, and this is the conical abutment which we can place, we can tuck in, and over this we can place the prosthesis. Either it is a fixed or it is the removable prosthesis. You can go with a digital scan or whatever impression technique you are using. So this is how you can plan virtually, and you can make the prosthesis, design and mill there and then. So coming up with a very important topic, that is the impression. They say first impression is always the last impression. I feel the first impression needs to be the best impression. So we have been using the conventional open tray, we have been using the closed tray approaches, and over the period of time, I feel we are using much more digital impressions, the intraoral scans, the extraoral scans, the concept of scan, design, and mill. I remember we had a virtual book launch with my very sweet Mr. Rubain and the official media partner, DentistChannel.Online. This is how we conducted the digital, the book launch, and even I had a chance to speak up with the first and the foremost lecture on digital impression. So this is how the digital impressions, there have been a close fight between digital impressions and the conventional impressions, but they are doing really well. The digital impressions, they have so much of accuracy, so much of satisfaction, preference of the patient, and reduces a lot of time. So there have been so many advantages over the disadvantages which we can feel. And friends, we do need, this is a scan post or scan abutment or a scan body. So we definitely need a scan body to scan the area over which, this is just an analog, over which we'll be sending it to the lab, and then lab guy will be designing and milling the prosthesis. Coming on to the occlusion, the most important aspect. So we keep talking about that, place the implant, it will be a success, it will eventually osseointegrate. But what about, the foundation? What about the occlusion? That's more important. So over the period of time, I feel the tech scan, the computerized occlusion analysis will tell you in a best way how to go with the occlusal analysis when you are giving implant protected occlusion. So there are high pressure areas, there are low pressure areas. T-scan, I was reading again in combination with the joint vibrational analysis and electromyography is doing really well. The research is going on. And even in certain digital scanners and softwares, we have the provision of the occlusal analysis. So this is how still, T-scan as, digital analysis of the occlusion is doing really well. And my friends, let me tell you, if your occlusion is correct, this is a total success to your implant treatment. So please don't deny, please don't neglect the occlusal aspects of implantology. And another study I was reading, the effect of Botox. So Botox, we are, very popular in facial aesthetics and clinical cosmetology. But yes, we are using these Botox injections, particularly as a prophylactic measure to reduce, the kind of occlusal loading. I could see there is a 30% reduction in occlusal loading when we are using the Botox BTXA injections, particularly in the immediately loaded cases. And you all know till 2019, we were very happy, and 2020 experienced the abstruse virus, that is a COVID. So there were certain implications of dental implantology. Now, generally, we tell the patient or to go for, we are going now more digital in this lockdown period, or particularly now we are into the unlock period. But yes, as far as the implant placement and restorations are concerned, we are more into the virtual, we are more into the diagnostic modalities of CBCT and slow drilling protocols so as to avoid the aerosolized transmissions. We are moving more towards the digital scanners or the impressions. Well, I was thinking, what would be the world in 2030 after a decade? I feel the kind of innovation, the kind of technology going on so rapid and so in an innovative way. I think it can be 2 or 3 years after. So some things which we would be regularizing in the times to come. One I was reading was the hyperbaric oxygen therapies, generally in the cancer patients, but the studies suggest that they will definitely improve the osseointegration over the period of time. The gene therapeutics in combination with implant, commonly known as, there has been a term for implantogenomics or implantomics. So this is how the gene therapy, the DNA identification in consonance with the implant systems will be doing really well. And there will be a very, new thing which would be coming up, that is again, which has been researched upon, that is the pulsed electromagnetic field. So slight electric currents will be generated there will be a sensor for this, and there will be slight currents which would be generated into the bone. So it will help in the rapid osseointegration. As you can see, the electromagnetic field will be created into the bone, and this is how the bone formation will be relatively faster as compared to the conventional implant systems. The concept of virtuality reality doing really well. The augmented reality, in which we have a real track, and a very new thing has come up, that is the mixed reality, that is a combination of virtuality reality and the augmented reality. So this is how, it's a good tool when you are educating the students. It's a good tool when you are doing some courses or some hands-on. So this is how the technology will be very normal, what we are talking now. And 10 years after, this will be say, oh, that's very normal, what you are talking. So this is how we will have the real time effect, or the real time situation. We'll be converting the virtual patient into actual patient, and we'll come to know all the anatomical structures. Where are we going? What is the size of the implant? How much to go into the bone? And I think we can place implants in each and every aspect of the body. Another beautiful thing, the cell sheet engineering. So there have been researches going on which say that there would be formation of periodontal ligament or the cementum around the implant in the times to come. Let's see how we are going about this. The robotic implantology. Everybody tells about the robotics, and we are quite into interesting into robotics or dentronics. So this is how the robotic implantology will also give the live tracking of the anatomical structures. This is how the workflow will go. We'll have a proper tracking system. And for particularly zygomas, which are really tough to deal with, that would be a great innovative idea. I was seeing an article on electric implantology, where the electric implants have been used in all the aspects of the body, monitoring the electrical activity in various aspects. So there will be a common electric dental implantology, which will even reduce the thermal currents, which will tell us about how much is the temperature. There would be sensors which would be temperature implantable sensors, which will tell us about the temperature increase, maybe due to some inflammation. So this will tell us much before time when any patient is gonna experience any peri-implant disorder or peri-implant disease. And due to this, we'll come to know, okay, those would be the warning signals for us. So the temperature, if it increases, so we'll be really, we will be cautious. Okay, we have to call the patient, and then through those sensors, we'll come to know the ideal and the non-ideal thing. I was seeing majority of the times there are issues with the implant system identification. So a beautiful innovation I was reading, we need to have a QR code scanner. I feel now it's a era of digital technology, and this is how we can just scan, and any patient coming up to any other practitioner or anybody into the academic institute, so we'll come up to know, okay, by just scanning the QR code, we'll know what is the brand, what is the size, each and everything. This is how we will be able to decode the implantology, the system, and would be a really boon to the forensic identification. The wireless tracking implantology, this was what my opinion was, that there would be certain wireless trackers just for security purpose into the implants, but that would be really difficult for the husbands. Their wives can easily track them. So the ultrasonics in implantology, again, that is one of the topic which has been actively researched upon. So the implant depressions, the ultrasonics, again, they are coming really well. And even the ultrasonic decavitation, we have to remove the biofilm from the surface of the implants, and the ultrasonic waves will definitely propagate over the period of time, and this will lead to more induction of the bone and more osseointegration. And ultrasonography can also come up for the diagnosis of peri-implant disorders. The artificial intelligence, that is again doing really well with so many. Now this is something very technical, but very briefly I'll be telling you. One of the deep learning or convolutional neural networks are doing really well, particularly when we are talking about the diagnosis. We are talking about the crown designs, which would be with a period of time much active. the implant crown designs would be coming up from the artificial intelligence library, and this is how we could be able to make the impressions. Again, implant impressions with micro CT scan would be a boon. The dimensional QC, another strategy to reduce any aberrations over the surface of crown, any roughness, any high points. This would be again the era of dimensional QC, and using combined digital impressions with the photogrammetric technique with the sensors and with intraoral scan. So we'll be, superimposing the standard tessellation language STL files, and this is how we're gonna make a beautiful designing and milling of the processes. So we would be having, we are really into the smart world, and a concept known as smart implantology will definitely come up with some LEDs which will tell you about, again, the temperature sensing, which will tell you about the forces, the occlusion, each and everything into the patient mouth that you can easily sense. And this is how beautifully it will be connected to the digital scan or your device. This is, I feel, up till now, this could be the most innovative thing. Now we know implants are ankylosed into the bone, but I feel that dental implants are really now will be coming up with the 3D shock absorbing property similar to the human natural tooth. So if this innovation comes, I feel this is going to be the best innovation in the field of dental implantology, because we totally compare about the dental implants and the natural tooth. This is how we would be simulating, and we would be coming up with the cushioning effect of the dental implants. And I was thinking, will implant innovations will be a virtuality or reality? So after seeing this video, I feel that if such things can happen, then why not? The dental implantology would definitely come up with the realistic innovations. So this slide is totally dedicated to my very dear postgraduate students from all the universities from all across India who are there or maybe offline. So there is a question. This is something, academic based. So generally we have in the university, we have a question on recent advances or trends in implantology. That's a very long question. So this is how you are going to make the contents, and you can take a snapshot. I'll be sharing a link with you, so you can just have a look on that. And particularly, this is how you can write your answer. This was just, particularly I dedicated particularly this slide to my, it can be for the undergraduates, but particularly I have dedicated this slide to my postgraduates across the globe. Well, to conclude the session, I feel it's not the take home message, it's the take in message, since we are into the virtual world. So definitely there has been a paradigm shift from the conventional to the virtual to the digital to so many strategies which we are yet to experience. Always, have good knowledge, master the conventional implantology and even the unconventional implantology. There is, no end. We say sky is the limit. No, sky is even not the limit. Our vision is. So let's broaden the vision to come up and learn. Learning never stops. Keep learning into implantology. There are so many beautiful things, and need to have good knowledge. You can be updated with the proficiency, with the skills which come up over the period of time. It's not a one-day job. You need to, practice more and more. And this is how you can come up with the implant success. And with this also, I feel there is further more research required, particularly in this topic. So much of research is still needed to say, because again, there have been a lot of articles. I could see plethora of articles, but even then I feel there is no definitive conclusion. There has been a limited research. We will be coming up. Definitely, we need to be updated. And one thing I forgot to mention, I read one article, 3 a.m. in the morning today only. There has been a new alloy which has been introduced. That is a combination of zirconia, 25 times titanium and molybdenum, which lowers down the elastic modulus of titanium equal to that of bone. And that has been today only discovered, or maybe 1-2 days back. I read this article just today. So I wanted to be updated till today. I don't know what is coming right now, but then we need to be updated with all these promising magical innovations. So with this, my very dear sweet participants, I feel I couldn't make you, didn't make you feel like this with my presentation. It was 8 a.m. in the morning. So sorry, I had to wake you up with my presentation, but I could try to create some interest into the presentation, and with a positive hope that it's never next, later, tomorrow, day after. It's now. So let's start right now. Whatever we are doing, we are upgrading our knowledge, we are practicing. We should start right now, just like the river to sojourn the feeling. And just wanted to share some books I contributed into the field of implantology, some of the e-books. So just a flash on this. And once again, I feel I really congratulate, I thank my best wishes to Dentist Channel Online. That's my family. I feel I am very lucky, I'm privileged, I'm proud to be part of Dentist Channel Online family, who again gave me a chance, who gave me this great honor to come up to such unique podium and speak up on this topic. I really congratulate them that in 2020, this is the first ever dental implant virtual conference. With I really wish them the best of luck, that they come up with big success, with a huge success. And to my very sweet dear moderators of the session, particularly I have told about Mr. Rubain, Mr. Sikri. They are burning the midnight oil to work. I was seeing how passionately they are moderating, hosting the sessions, and it really feels good that you are learning from them. And I would say my best wishes, congratulations. I was into some of the virtual sessions, and I could see the passion, the zeal with which they are the stalwarts, they are the internationally acclaimed speakers. And I am, they are all the big shots. You can say I am a dairy milk shot in front of them. But then that is how I was feeling really good. The best part was I am the youngest of all. So this is how I don't want to be old. I am taking this as a compliment. And this is how I want to be, moving on to more and more of learning day by day. Every day you must learn. Every day you listen to lectures, you learn, you gauge some new things, you get updated. So this is how, I feel good when I am updated. I am young. I am more than a teacher. I am a student. So I am really blessed to be a part of the channel, the family, associated with the lovely speakers out here. And I think I'll be failing in my duty if I don't thank my very patient, my very sweet, my very dear participants out here for your esteem and the gracious presence. Without you, this wouldn't have been possible. So I wish you once again happy Ganesh Chaturthi, wishing you all the best for all the future endeavors, wishing you good luck, a very good day, a very good Saturday. Thanks once again. And these are my contact details in case you want to be in touch with me. That's my email ID. That's my contact number. Nowadays, I'm on Instagram also. So I'm trying to be, socially active. Thanks to Rubain for giving me the idea to come up. And I'm trying to be, socially more active in these beautiful podiums. So this is how, in case you have any doubt, and please, I'm learning something new. So I feel that this presentation should move across the globe, so that every day we are being updated, every day we are learning something new. And please give your valuable suggestions, your valuable feedback, inputs, whatever you have. Maybe I have missed something. I would be very happy, and I really acknowledge if you have something, or in case how I can improve upon my presentation. Thank you once again. Thank you so much. Wishing you a good day, and namaste. Thank you.
All right, ladies and gentlemen, it's now time for us to start with the question and answer session. We move with the first question. So my question is, in these coming years, in this post-COVID era 2020, does artificial intelligence will be one of the modules in college?
Yes, I strongly feel, as we are into the uncertain times of COVID, and I feel post-COVID dentistry, I even know that artificial intelligence is doing really well, particularly in the COVID-19 diagnosis. When I was in conversation with the medical guys, this was how, in the diagnosis, in treatment planning, this was how, with the convolutional neural networks, with the thread designs, with the treatment plans, this can really come up then we need to have some sort of conversation with the higher authorities. They are the exact givers of the course or something like that. But yes, I think it's a good suggestion. I think we should write it to the higher authorities or the council to come up with more such futuristic course. Now I feel I am not comparing. I feel across the globe, I was seeing that abroad, pan India, they are doing really well. The mixed reality was what I was talking about, has been implemented in one of the university in Hong Kong. So this is how, why not we can't do it? It's not to compare, it's to just come up with the futuristic considerations to join hands together, come up standing neck to neck, learn the updates, the new modalities. And if we are experiencing such things, and this is how we'll be over the period of time, artificial intelligence may even reduce the aerosols transmission also. So let's see how it all comes. Thank you.
Thank you very much. So next question, could you mention more about the bone regeneration to make an implant successful?
Yes. So bone regeneration in implantology, there have been strategies. Now let me tell you, if I talk about, I feel the best possible is the autogenous bone graft. So what we do is, when you have a large defect, okay, you don't have any bone, or there was some residual infection into the bone. So now when you are curating out the granulation tissue, you have a very large size defect. Now you can't totally rely on the implant. You have to come up with the bone, some strategies with the regeneration, which includes the autograft, allograft, xenograft. And there have been strategies with a combination of autogenous bone grafts, the autogenous bone chips, in combination with the platelet rich plasma, which has the platelet derived growth factors, PRPs, PDGF, other growth factors coming in. And I was talking about the tenting screws. So a combination of the grafts, a combination of the PRS, and one new technology which I forgot to mention is the 3D printed bone peak scaffold. So this is gonna be the innovative technology when we are talking about the bone regeneration. I think the best technology up till now, what we are using practically, is the autogenous bone grafts. So they have a huge success rate. But I feel much above that, we would be experiencing in due course of time a technology which is known as a 3D printed bone scaffold made of the sheets of polyether ketone. This is the most recent innovation what I have found it out. So this is how the bone regeneration would be, and it would come up in the earlier, in early course of time. Normally we have to wait for 4 to 6 months, but now we will be, I think in within 10 days or 15 days, we would be really helpful. It would be really helpful to augment the bone healing, the bone osseointegration, and with the various regeneration strategies will be coming up like this. Thank you.
Thank you. Last question. So where do you get your updates on articles and publications?
Yeah. So this is a good question. Generally, I have seen the PubMed index journals. Okay, NCBI, you can just surf on the NCBI site. You can see the Science Direct. You can see the Willy online library. You can see Elsevier database. You have the Sci-Hub. Then you can have the Cochrane database. So lot more indexed databases are there. I even looked at the Google Scholar. So I read a chunk of articles, and this is how I am also updated. In case you want me to send me a link, I'll definitely do that for you. Thank you.